much. Good morning, everyone. Today, I'm going to present this topic. This is the collaborative research between Mahidol University and Ministry of Public Health, Thailand. So there are three organizations. First one is Research Center for Health Economic and Evaluation, Faculty of Public Health, Mahidol University. The second is the Faculty of Tropical Medicine, where the vaccine trial unit allocated there, also in Mahidol University. The third organization is Department of Disease Control, Ministry of Public Health, Bangkok, Thailand. I know genital warts caused by human papillomavirus is almost always transmitted by sexual contacts. HPV infection is the most common sexually transmitted diseases worldwide. It commonly occurs among men, especially among MSM, men who have sex with men, and highly associated with HIV co-infection and high-risk sexual behavior. In Thailand, Ministry of Public Health report in 2007 about the cure rate of anal genital wart. It's about 0.79 per thousand population. Increasing trend of epidemic despite the strong government prevention and control effort. The picture down here show the severe cases of external genital warts on female and male. At these junctions of availability of the HPV vaccine, so the Ministry of Public Health would like to know how to prepare for the policy on adoption of the vaccine in Thailand based on a solid understanding of disease burden and cause of illness, like Professor Tintin Su presented as well. Commercial sex and its related epidemics of sexual transmitted disease, now I will call STD, are becoming an increasing problem. Effectiveness and sustainability of STD prevention intervention, targeting sex worker and the client are important. Comprehensive intervention, STI and STD, have been implemented using several strategies. This is government strategy, such as improve STI care services, promoting healthcare seeking behavior, and promoting condom use. That all of you may know that Thailand has successfully started on 100% condom use promotion. The new strategy has been provided by outreach that taking care for the target establishments by STI or STD cluster. The main study objective regarding about the cause of illness, we have two objectives that I'm going to present today. The first one, to assess the direct and indirect costs of genital warts on service provider and client perspectives, and also to estimate the actual government program expenditure for prevention, control, and treatment for the National STD Prevention and Control Plan. After we got approval from ethical committee, both at the national level, Ministry of Public Health, and also at Mahidol University. This slide shows you the clinic at Bangladesh Hospital, Bangkok, Thailand. This is the team. This is Bangladesh Hospital. So the STI cluster, or STD cluster at Bangladesh Hospital actually is a government hospital under Department of Disease Control, Ministry of Public Health. Now, I would tell you about our methodology on cause of illness. It was a prospective observation study conducted at the clinic I show you in the picture. From June 2012 to September 2013, 15 months. Proportion of anal genital warts the total of number of STD calculated from database from that hospital. After the baseline assessment, the participant has 3 follow-up visits. This is for costing data. At day 7, first month, and 3 months after recruited. On each visit, patients were clinically examined and treated, follow standard medical practice. I show you later about the treatment protocol. Patients were interviewed for healthcare costs, work productivity loss, and activities impairment. At the 6th month, we do the telephone assessment for the sign and disease recurrence. Regarding the provider cost on patients with Warts from the service in Bangladesh Hospital, was assessed using activity-based costing, direct, indirect costs, and some external costs. Patients with Warts visited Bangladesh Hospital for service in 4 clinics, namely clinical research women, clinical research men, women health clinic, and male health clinic. The secondary data from the government agency were collected on resource, budget, and budget in situation under universal coverage, or we call in the short term in Thailand universal coverage, and other related STE programs. Sources of entire allocated budget to each province were mainly compiled and analyzed to estimate the total resource needs for STD program. Now I come up with the result. A total of 131 patients with clinical diagnosis anal genital warts were recruited. Proportion of anal genital warts to the total number of STI in 2012 at Bangladesh Hospital was 14.6%. The mean age of the respondent or the patients was 28 years. HIV positive, about 2.4%. Finally, we recruit 72 cases in costing study. We cannot include all the 131 because this is the ethical committee suggests that we shouldn't put the patient come to the study. This slide shows you the demographic data. You can see the proportions of male a little bit more than female. Referring to the occupations, the patient identify themselves as a sexual worker or commercial sex worker about 25%. What we worry, you can see 18% are students. Education obtained. Most of the clients got education at the high school level, 43%. 27% bachelor and about 1% or 1% obtained master degree. For the maternal status, mostly identify themselves as a single. Some married and some divorced and separated. This is the first result that I would like to show you. It's about direct medical costs, but patient's perspective. The treatments of what in Bangladesh Hospital was actually free of charge because of the externalities, so the government support free of charge services. The government subsidy was 120 baht or $3.5 for each physician administered solution. Some patients, before coming to this clinic, they also treated in other hospitals or had self-applied medication. Medium expense of treatment from the patient perspective that they told us, or the cost is about 1,000 baht, or around 27 US dollar, and this is the range from 130 baht to 4,000. This shows you the direct cost from the clinics. We use the time allocation for each clinic. So we found that Women Research Clinic has the highest direct cost, and the total direct cost is around 111,000 baht, or around $3,200. This is direct cost. Indirect cost. All patients were treated as outpatient cases. About 72% came to the hospital without work absenteeism. But after having this disease, the work productivity reduced to 83%, and daily activity also declined to 82.4% from baseline. In general, we can summarize that provider cost of treatment was higher than out-of-pocket expenditure. The disease also led to the reduction of work productivity and daily activity. This is the detail of indirect costs. Travel, food, and other costs occur to the patients. Traveling of the caregiver mostly was the wife taking care of the husband, and food. This number of visits. So we had cost per visit in each category. The unit cost for indirect cost of each average at 966 baht. Or the total cost is this amount. So we calculate with 72 patients, we have direct and indirect costs together is about 226,000 baht. You may want to know about the treatment and the outcome. All patients were treated once weekly with physician administered podophyllene lesions. I hope I spell correctly. And all self-applied imiquid mode, also 2.1%, because the price of the drug is very expensive and the client have to apply by themselves. The mean treatment visit about 7 times per visit. 7 visits, range from 1 to 12 visits. The outcome at the 6 months, we found that 12.2% loss to follow-up. It means not coming to the hospital anymore. And lost follow-up, and then 1.5% discontinue. 55% were killed. 25.2% still had ongoing anal genital warts, and 5.7% has recurrent. These are the treatment methods. So podophyllene is the most famous treatment at these diseases. They also have glycolic acids also, about 16%. And together, podophyllene and TCA is about 4.6%. This slide shows you about the government expenditure. I will have the detailed slide after this. So estimated total cost resource needs was 81 million US dollar. But the actual government program expenditure for the prevention, control, and treatment of STI was only 24 million US dollar. Therefore, actual spending on STD from the government agency was only 30% compared to the estimated resource needs. This is the estimation of the total resource needs that come up with $81 million from intervention called prevention intervention, voluntary counseling and testing, STI clinic, and also M&E. This shows you the national department other sources of actual expenditure that we collect the data. The first one, this is Universal Health Coverage. National Health Security Office is the highest one. BATS is Bureau of AIDS, TB, and STD under the Ministry of Public Health. BMA stands for Bangkok Metropolitan Administration and other. Altogether, 24 million US dollar. That comes to the conclusion. Anal genital warts are common STD and tend to be recalcitrant to treatment. It's not easy to get cured. The provider cost of treatment was higher than out-of-pocket expenditure. This disease also leads to the reduction of work production on work productivity and daily activities. Conclusions and recommendations. Evaluation of the treatment costs due to genital warts could be used to develop direction of target services at the most appropriate. National resource need estimation are important for the country to provide comprehensive intervention, prevention, control, and treatment by government agency and other key stakeholders. Thank you very much.